Hi, I'm David Haynes. I'm the Director of Otology Neurotology here at Vanderbilt. I'm from Bristol, Tennessee on the Virginia border, college at University of Tennessee, med school across the state in Memphis, and then I did my residency and been here in Nashville since 1996.
So my name is Elizabeth Perkins, and I'm the current second year neurotology fellow, and I am hired on as faculty for summer 2021.
I knew from the beginning that this place was going to be a powerhouse. You know, a lot of people said, why would you go to a startup, you know, but you could see the energy here. Jim Netterville was here. There were a lot of players coming here that were going to make this place great. In addition to Liz, we have a very large neurotology faculty, which I'm very proud of. We have Mark Bennett, who is our quality and safety officer, who has a large institutional role. We have Matt O'Malley, who's a superb clinician and surgeon, who is in charge of our EPIC clinical operations. We have Dr. Labadie, who's an MD, PhD, who's an NIH-funded investigator, who we're very, very proud of, who is very academically involved in this department, in the Department of Engineering and Hearing and Speech Sciences. And we've hired a recent new faculty graduate, is Kareem Tawfiq, and he just started with us in August. He's actually our first graduate that didn't train with us, and he's already going gangbusters.
Wonderful.
From the ear standpoint, we've merged perhaps the premier ear training program in the country that was across the street, the Otology group, and the #1 U.S. News and World Report ranked Hearing and Speech Sciences program, the Bill Wilkerson Center, now merged all together into one spot. As we've done this process, we realized we have a list of things that we have to do better with. And that list included pre-visit education, and Liz has done a good job with that.
Yeah, we developed an entire video series that will help educate patients on the cochlear implant process, the candidacy evaluation, and the surgery itself. And we really want patients to know that we're thinking about them before they even really know we exist.
Cochlear implants were very time-oriented for patients.
So a patient arrives on our campus, have nothing to eat or drink, and they get their hearing test, they meet the surgeon. If they met the candidacy criteria for a cochlear implant, they have the surgery that afternoon and are able to go home. It is a streamlined process where instead of traveling back and forth to Vanderbilt for their appointments, it really is a patient-centered program that is developed to reduce travel burden and time off work for patients. I'll take the opportunity to brag about you for a little bit. I think residents here really get the opportunity to train with some of the best neurotologists in the world, and certainly within the United States. And when they graduate from this program, we can guarantee that you're getting well-rounded otology training and that to set you up for your future career and your next step.
We intentionally try to train our residents and fellows to be great at everything they do, a great clinician, great leaders, great surgeons, and we have a small amount of time to be here to train them, and they give a lot to us. They give their lives to us and their nights and days and weekends to us, and we, instead of just dismissing that as a rite of passage, we work very hard to make sure that that's valuable to them.
You know, we're all very kind of try to be down to earth and treat each other equally. There's no really hierarchy here.
We're always telling stories about things that happen in the past that I think, I think has a parable, a lesson to it. So we have all of the aspects of otolaryngology covered here, and I think we have an advantage being relatively isolated. We don't have another program down the street or across town or even very close at all, and it allows us to concentrate a lot of expertise here in all the aspects of otolaryngology. And from our ear standpoint, we have that legacy of the Otology group. And the collaborations that we've already established with neurosurgery and with hearing and speech sciences are well established, and we're all on the same page to working together to make this a great program. Caring for people. I'm teaching people who are smarter than me and brighter than me and harder working than me, and there's no way I feel burned out from this. We work very hard, but we're doing something meaningful and educating the best. You know, the overarching ability to care for people and the overarching educational opportunities that we have to teach are what keep us going, I think.